This is Dr. Craig Castanet again in Decatur, Georgia, at Back Strong Clinic. I'm going to review today a lumbar MRI scan. This is a T2 weighted image of this gentleman's low back MRI scan. He's 76 years old. He's had back pain off and on for years. He's not very symptomatic right now, but he has this residual tingling and numbness in his left big toe, second toe, and third toe, which is, as you might know, the L4 and L4-5 nerve root distributions. This tells me, this MRI scan, let me orient you a little bit. So his abdomen would be here. This is his low back. These are lumbar vertebrae. You can see that this disc height is reasonably good, no significant disc herniation. This is the L5-S1 disc because there's L5. This is the top of the sacrum or S1. Here we have L4 and there's L5, so this is the L4-5 disc. There's a significant disc herniation in this particular slice or image. This is not a midline slice, although he has a little bit of scoliosis, which you can infer from the fact that the canal looks different at this level than it does up at this level where it's very open. And this disc here is collapsed. This disc here, the L3-4 disc, is also collapsed. This has better disc height at L2-3. This disc height is good, no herniation. It's white in color, meaning it's hydrated, so there's no significant degeneration, in contrast to this one below, and these two, which are not just degenerated, but collapsed from long-standing collapse. The bones themselves, the end plate of L3 here and the superior end plate of L4 have swelling or modic changes. This is why it looks white here, and here from long-standing compression of the bones, which impairs the circulation across the disc, resulting in this stasis of fluid in the vertebrae. There's some end plate modic changes of L5 as well, of the superior end plate. You can see how widely patent the neural canal or central canal is here. These little lines are nerve roots, individual nerve roots. The canal is a little bit narrowed here by this disc herniation. It's more narrowed here by this long-standing change here, as well as enlargement of the ligament and joint. And in this particular slice at the L4-5 level, you have the big disc herniation there. You have significant hypertrophy of the ligament and flavum and arthropathy of the joint, making for a very narrow passage here for the nerve roots. Again, wider at the L5-S1 level. Let me go to a couple of other slices now. This is another sagittal slice. It looks more open here because this is not in the same slice. It's a little more parasagittal, a little more midline, so it looks pretty open here, reasonably open all the way down, a little bit narrow there, but still much more patent or open than the other image I just showed you. There's still the same disc herniation, same disc collapse at L3-4 and L4-5, good disc height at L5-S1 and up here at L2-3. And you don't really appreciate the hypertrophy of the ligaments and the joints here that make the canal so apparently narrow in the previous slice. Let me go to the next slice. Again, another more sagittal image. You see the end of the spinal cord here, the nerve roots that extend beyond the end of the spinal cord all the way down here. Look at how widely patent in this particular slice everything looks. You still see the good hydrated white colored disc with no significant degeneration at L2-3, L1-2. L2-3 is darker, it's lost some water content, but it's not collapsed. L3-4 is collapsed, L4-5 is collapsed, and L5-S1 looks good. Now we're going to look at this canal here in cross-section to see what we can see. I'm going to show you this cross-sectional image. This is the canal. It should be white, symmetrically white. So if, for example, I draw a line in the midline across here, all this area is white, and you can see there's dark tissue here. That's the disc herniation we saw in the previous sagittal image. It is on the right side and occupies part of the right foramen at this level, which is the L4-5 level. We do also see atrophy of the multifidus muscles, the intrinsic muscles of the spine on both sides, commonly seen in chronic back pain and degeneration, because there's not a lot of movements happening back here because the discs are collapsed. So there's not a lot of use, hypertrophy, or normal muscle mass here. You see disuse atrophy, essentially. Notice that I said that this is on the right side, which does not correlate with his left-sided leg symptoms. And he's perplexed by that, but I explain sometimes, not typically, but sometimes you see non-correlation between the anatomy of the MRI scan and the symptoms or signs of the patient. So I don't see any significant lesion on the left side, but some chronic, long-standing residual issue is present on the left side, resulting in his left-sided symptoms. Let me go to the next slice. You see a broader, less focal disc herniation still on the right side here. You see the open neural foramen on the left side, and you see it's closed off here on the right side, and yet his right side is fine. He has had previous sciatica on the right side, so this probably accounts for the previous sciatica, but it's quiescent now, not bothering him. I'm going to go to the last image here. And again, you see that disc herniation there at L4-5 on the right side again, nothing on the left. And that's the way it goes sometimes. I told him that I probably can help him with his symptoms, but I don't know with any certainty. And you know, this is interesting, but you do get these sort of lingering symptoms in a lot of people with disc collapse, where the complaint's not acute and it doesn't require treatment. It's just sort of a nagging annoyance and concern for them. So I told them, I can treat you. We can see if you respond to it. I don't think we need to try very many treatments to see if I can help you at all. But I think it's worth trying if it bothers you enough. And we'll probably know within a few treatments if I can help or not. And if it helps you, then maybe you want to do this to try to resolve or at least reach maximum medical improvement, meaning improve to the extent possible from your lingering left-sided symptoms. So anyway, that's the story in this gentleman. My name is Dr. Craig Castanet. If you'd like to learn more, you can watch a variety of other videos on my YouTube channel. You can look up Craig Castanet to find my YouTube channel. I have a couple. You can also go to my website to learn more, backstrong.net. If I can help you with your back problem, you can call me at 404-558-4015. And again, go to my website if you like. Thanks very much. Bye-bye.